My name is Gasia, Mikaelian, and I'm coming to you from KTVU Fox 2 News, serving the San Francisco Bay Area. Today, we are talking about COVID burnout. I know we've touched on this a couple of times during the pandemic, but Dr. Margaret Cochran is here to explain to us why we are still feeling burnout, even though some of us are maybe back to the office, probably back to school. Life has opened up a little bit.
Yes, well, as I affectionately refer to it, pandemic poop out. We have had enough up to here with all of it. And part of what it is that when you're going through something difficult, you have to surrender to it. And the word surrender often gets a bad rap. It's like, you give up. No, it's not about giving up. It's about truly accepting. Yeah, this virus is here to stay. It's not going anywhere. Just like influenza, just like polio, just like, all the rest. But we do have ways to be able to keep ourselves as safe as we possibly can. And we need to remember to use those and not give up on self-care because we get anxious, because that burns you out faster than anything else. And to be able to remember that while physical distancing is important, social distancing is a bad thing.
Right. I mean, it's hard because when we started this world of, working from home, wearing masks, only going to the grocery store once, in a sense, it was exciting, right? How many gallons of milk can I pack into my fridge? How many ways can I use up bananas that have gone mushy? Now, after a year and a half of banana bread and a year and a half of walks around my neighborhood, I think I've met everyone there is to meet in my little, 1 mile radius. So even those things that were kind of interesting and exciting are now like, this again.
Mm-hmm. Yeah, I've started counting lizards around my house. Yeah, well, it is different. And part of this, though, again, it has to do with attitude, and an attitude of gratitude. I'm really going to encourage everybody listening to start a gratitude practice. And that just means you start your day out, remember the things that you're grateful for. And if you're really feeling grumpy, that can be difficult to do, but there's always something. There's always something that you love, and you can begin in that spot. And once you begin to do that, set some perspective. Yes, I am cooped up. I am limited in some of the things I can do, but I'm not sick. My children aren't sick. Hopefully you're not sick, and hopefully your children aren't sick, or I'm getting good medical care, or there is a vaccine available, or whatever. It reminds you that there's more than this one pinpoint disaster.
Right.
It opens up the horizon so that you can see more.
I remember at one point during the last year or so, I had to go to the doctor for something, not COVID related, but I just felt so grateful that I had a great family doctor. And I even said aloud, thank goodness for health insurance. And I know that health insurance is a huge burden for so many people. You can't get it, you can't pay for it, but never have I been so happy to see that, that visit to the doctor, those couple lab tests, whatever it was, wasn't going to be a financial burden that meant I couldn't pay the rent, or I had to really be choosy at the grocery store. And I just thought, wow, thank goodness for health insurance.
Yeah. Well, we have lots of studies that show healthy population, physically healthy and mentally healthy, is a more productive, happier population. Yeah. So that physical care is super important. And during the pandemic, a lot of people have understandably not done things. They go get their mammogram. They don't want to go to the dentist because it means at a building where other people are, and it makes them uncomfortable, and understandably so. But doing everything you feel you can safely do with the most appropriate precautions. Sleeping well, our crenellated brains have to rest, and also being able to have fun, finding ways to bring pleasure into your life. And drugs and alcohol, by the way, are not the best choices for that. Yeah. The best choices for that are finding ways to give back. And it doesn't have, you don't necessarily have to go to the Salvation Army. Maybe and put it on your neighbor. Maybe you dog sit for one that is ill. I mean, there are a lot of different ways that you can do it, and a lot of really cool things you can talk to your kids about too.
I like it. All right, Dr. Cochran, is there anywhere we can find you online to learn more about avoiding COVID burnout?
Dr. Cochran.
drcochran.com. Thank you so much for joining us again.
Thank you for having me.